Well, hello, age disruptors. Today, I'm recording this podcast with a live studio audience. All of you attending this recording are members of the Hack My Age VIP program, and part of being in this exclusive club is the ability to dial in and watch the interviews as they are recorded and ask your own questions. And if you want to be a part of this amazing community, go to patreon.com/hackmyage and sign up not only for these cool interviews, but free breathwork and meditation classes and private consultations and so much more. So you probably have heard of my guest before. Over the last several years, she's been on the podcast circuit. She's all over Instagram. She speaks at loads of health conferences all over the world with leaders in longevity like David Sinclair and Dr. Sandra Kaufman. And she stands out because her jam is sex and skin. These are two things we all want to keep glowing as we age. And this is the one and only Dr. Amy Killen. And we're going to bust some myths and reveal some truth today on women's sex lives in middle age. Thank you very much. And Dr. Killen is board certified in emergency medicine, and she decided to pivot her career into the field of regenerative medicine and medical aesthetics. And she is now the medical director of a national regenerative medicine physician training course. And she's well known for her work with Dr. Harry Adelson, who came up with the full body stem cell makeover. Now, if this doesn't say biohacker all over it, I don't know what does. This is one of the most innovative regenerative procedures I've ever heard of in my life. It's like better than the bionic woman. So Dr. Killen has the coolest part of this procedure. And what she does is she combines stem cells and exosome injections. And don't worry, we're going to explain all of this, what that means, with light, sound, and other energy-based therapies so that you can get this really amazing regenerative effect on your skin, your hair, and of course, your sexual systems. So we can all have happy endings.
Yay!
Yeah. So without further ado, meet Dr. Killen.
I'm so excited to be here. Thank you so much for having me.
I'm so glad you're here. And I got a ton of questions. I'm really excited to bust some myths. I am a big fan of yours, as well as some of the people here listening to you. You're doing an amazing job, really sharing some fantastic information. I highly recommend everyone to follow you on Instagram. And you're Dr. Amy B. Killen, with the letter B in that, right?
That's right.
Please go there and follow that. So because you're such an expert on this, but out of curiosity though, I really want to know, what is it? Because you were in emergency medicine. So how did you even make this transition into the regenerative medicine space?
Yeah, so I was an ER doctor for about 10 years, and it was a great job. I liked it a lot, but towards the end of that, I had my 3 kids within 2 years. So I had twins, then I had another one 20 months later. And then my husband kind of moved out of state to take a job. And I was like a single parent to all these small children. And I was working at a shift in the ER that started at 4 a.m. So I was getting up at 3 and, just not sleeping, not eating well, not taking care of myself, chronically stressed, like all the things, right? Like
accelerated aging.
Yeah, I could feel my telomeres like shortening by the day. I was like, I'm getting so old. So after a few years of that, I just realized that in order to kind of help myself, help my family, and even help my patients who I was seeing coming back over and over again to the ER with the same kinds of, chronic problems, that I needed to learn more about really longevity and anti-aging and eventually regenerative medicine. So I kind of switched over slowly over several years and started practicing a lot with, bioidentical hormones and sort of longevity practices. And what was happening is I'd had a lot of patients that would come back to me after they started feeling a little bit better. And they would say, hey, I'm starting to feel a little better. My motivation's back. My depression's not quite as bad. I'm losing a little weight. And now can you help me with either my skin or my sex life? And I got these same 2 things so frequently that I was like, can I help them? And so I started kind of diving really deep into those fields. And I just find people are interested in like looking for alternative measures and combining that with some traditional therapies for skin rejuvenation, hair restoration and sexual optimization as they get older. So that's what I do now.
Do you find that you get these questions a lot more from older people or younger people, or is it about the same? When I mean older, I'm saying 50 plus.
Yeah, I would say starting in like the mid 30s to early 40s is when I start getting questions. I think especially with women, they start thinking about skin a little earlier than men. Men don't tend to think about that as much until they get a little older, and then probably mid 40s or so for the sexual health stuff.
Interesting. So what kind of, problems in general, like, specifically I want to focus on women over 50. So what are you seeing, when they're asking specifically about skin? Is it the wrinkles? And what is it about sex? Is there just low libido, or what's happening there?
Yeah, with skin, it's just general, aging skin concerns. So it's wrinkles, it's loss of structure, loss of volume, thinning skin, age spots, all the kind of things that just happen as we get older when we start to lose collagen and elastin and hyaluronic acid. Obviously, that you start to lose those things at about 25, it just gets progressively worse. But by the time we're postmenopausal, because you've lost estrogen, unless you're replacing it, then you see a big decline in skin health in general, because estrogen is really important for keeping your collagen structure intact and for kind of preventing the breakdown of collagen. So in people who are postmenopausal, not on estrogen, they'll often see a big kind of decline in skin health, and they'll come to me and say, "Oh my gosh, what's happening?" So that's the skin piece. And then for the sexual piece, again, it's sort of postmenopausal concerns, and that's oftentimes hormone related in kind of until we work on hormones. But it could be, loss of libido, it could be vaginal dryness, it could be pain, although I'm not an OBGYN. So if it's pain, I tend to refer them out to an OBGYN, do a workup for pain and see if there's something structural going on. And if not, then, obviously we can work on it. But those are some of the main things: loss of sensation, loss of difficulty orgasming, things like that.
Okay, so these are the people who are actually coming to you. So because you've got so much experience here, we're going to dive into some of these myths that I'd like to bust, or truths. And you're an expert in this space, so you can guide us and tell us if these are issues, then how do we fix them as well. So a big one that comes up is women aren't interested in sex after menopause. Is that true or not?
That is generally not true. Certainly, there are some women who are not as interested, but I find that a lot of women starting in their 40s become more interested, because I feel like they become more comfortable with their bodies. They become more comfortable kind of with their place in the world, maybe a little bit more adventurous, and so I see kind of an uptick in sexual interest in a lot of my patients who are in their kind of 40s and 50s. As long as the hormones are not completely super low and they've lost total interest. But I think that's probably a myth for the most part.
Mm-hmm. So low libido is part of that myth that we're going to bust as well. So, right? Or is that?
I mean, some people do have low libido for sure, but that's a population of people, again, who if you don't have testosterone, if you don't have estrogen, progesterone, all of those things which are going to drop after menopause, then you may have low libido. Not always, because it's the sexual libido arousal sort of system is very complex, and in women it's not just tied to testosterone or just tied to one thing, but certainly lower hormones can play a role in low libido if that's happening.
So there's almost like two questions. There's sense that women aren't interested in sex. Well, maybe they are in midlife, but they do have the low libido. So then we'd want to combat that. So you're saying that one of the ways you would combat low libido would be through hormones such as testosterone.
Yeah, you would at least check your levels, and if you're postmenopausal and not taking hormones, then generally you're going to have lower levels. And doing something, even if it's just occasional use of testosterone or estrogen vaginally to help with dryness or things like that you could use kind of sporadically, can certainly be helpful in people who want to increase libido, but it's just not quite there.
Okay, so let's move on to the next one. Some people would say body isn't designed to have sex in older age. There's aches, pains, disease, illness, inflexibility. What would you say about that?
Oh, I hate that. That's awful. I mean, there are all those things, but I think that all of us who are in this sort of longevity community are working really hard to decrease those things and to prevent them from happening, or like to push them to a later age. So, my rebuttal would be that we should be taking good care of ourselves. We really should be obviously trying as best we can to stay as healthy for as long as possible for many reasons, including so that we can still enjoy sex.
Yeah. And those maybe kind of go hand in hand. Like if you're not taking care of yourself and you're having all these aches and pains and you're inflexible and you're feeling like crap, well then, well, yeah, the libido is going to go down because you're in pain.
Absolutely. Yeah.
Which leads
Yeah.
to another myth is or truth, who knows, sex is painful after 50.
No, it should never be painful. If it's painful, there's something going on there. I mean, certainly after 50, again, you can have vaginal dryness, you can have sort of vaginal atrophy or, thinning of the vaginal wall, and that can be painful, but you can use lubricants, and I'd recommend that. Lubricants are great for any age, but especially as we get older. So that should get rid of that pain if there is one. If there continues to be a pain, then you should talk to your doctor and see what's causing it. It could be a lot of different things can cause pain: structural problems, prolapse, vaginismus, where it's kind of contracting, spasming, things like that. But there are typically treatments for that, and it should never hurt for any
Mm-hmm.
age.
Yeah. So do you do anything in your practice in terms of that, or you refer out when somebody has pain?
I tend to refer out initially just to make sure it's not anything structural. If it's not, and if it's more like we need to work on lubrication or sensitivity or things like that, then I'll treat them, because I can do vaginal lasers and radio frequency and injections and hormones and things like that. But I'm not going to be doing surgeries.
Mm-hmm. It's interesting because this is where I would see maybe sex and skin tied together. When you are dried up in your face and your skin is all dried up, I understand that's not just on the outside, can happen
It's
on the
not.
inside.
It's not. Absolutely. Vaginal dryness is a key thing that happens when you lose your estrogen. And the problem with that is not just that sex can become painful and that, you don't want to do it. It also can have some effects on your pelvic floor health. All of a sudden, maybe you start to have some urinary incontinence because you don't have as much support of your pelvic floor structures. You're more prone to getting urinary tract infections because, again, those tissues just aren't as vibrant and as healthy. And so there are a number of other sort of health concerns that can happen because of that dryness.
Mm. So would you say that estrogen is probably one thing that would help both skin and your vaginal dryness or atrophy
Yeah.
or anything, right?
Yeah, absolutely. Vaginal estrogen is extremely safe for almost anyone. Obviously, talk to your doctor first. But vaginal
Mhm.
estrogen, which is you're going to be just using it, a few times a week or once a week. Once you get used to it, you don't tend to have systemic effects. So it's not going to help your skin, but it will keep the vaginal tissues healthy. And so that's a great option for almost anyone. And then systemic estrogen, which would be taking estrogen pills or creams or troches or things like that. That's going to be a great option for a lot of women. Not everyone. There's a subset that maybe you have a history of breast cancer or estrogen positive cancers or things like that or blood clots, that maybe it's not the best idea. But for the most part, taking bioidentical estrogen is actually very beneficial. For everything from brain health, cardiovascular health, bone health, skin health, vaginal health.
Mhm. I actually, a year ago, I was diagnosed with vaginal atrophy, and I was like, "What's that?" And because I didn't have any symptoms, but evidently on the radiograph or the sonogram, they showed that. I said, "Oh, okay. So what do I do?" So she gave me an estrogen, this little bullet that you put up your vagina, and I'm like, "Is that like what we're supposed to do?" And she said, "Yeah," and it was amazing. And in 1 year, I reversed it. And I didn't know you could reverse it. I thought we could just slow down the progression. And so when I did this, and I had some bit of a progesterone, had another doctor sort of give me this cocktail of progesterone, estrogen, And when I looked at her, I said, did you mean that I reversed aging? And she said, well, she's not an anti-aging doctor. She's like, I don't know if you want to go that far. And I said, yes, I reversed aging. Just admit it.
Absolutely. No, I mean, I think that vaginal estrogen is underutilized, under talked about. Like, it's so safe, it's so simple, and it can make a huge difference. And almost any doctor, OBGYN, family practice, any kind of traditional doctor, even if they don't have sort of a bioidentical hormone practice, are comfortable with vaginal estrogen and prescribing that. So it's something that if you're not doing it, talk to your doctor.
Yeah, exactly. Get that juicy vagina to make it happen. There's a myth that says sex isn't important as you age.
I think it's very important. I always want to sort of make a caveat, which is that there are people who are not interested in sex, and there's asexual people. It's just not their thing. And I think that everyone has an absolute right to their opinion, and no one should feel bad about whatever their interest is or isn't. The people that I try to treat are the ones who are interested, who do want to have this healthy sex life, but they're not there for whatever reason. But there's a decent amount of data out there that at least shows a correlation between a healthy sex life and a number of markers of health, physical health, mental health, emotional health, cognitive health, and overall sort of mortality. Now, we can't say it's necessarily causation, but we know that if you have kind of an active, healthy sex life, then it can decrease your blood pressure, it can improve your sleep, it can decrease your stress, it can help with emotional, mental things, like it can help with anxiety, depression, low self-esteem. There's some interesting studies in older people, and you might know about this with what you're studying, but in older individuals who are healthy, who have an active sex life, like having sex maybe 1 to 2 times a week, they tend to have less cognitive decline than the people who are not, doing that. And then there was a big study with a bunch of Welsh men years ago that basically showed that in this population of men, the ones who were having sex 1 to 2 times a week over a 10-year time period had a 50% reduction in mortality compared to the ones who were not. Now, again, there's probably a lot going on here, right? Like there's a lot of social stuff, there's a lot of things going on, but I think that sex is very healthy, and it's one of these pillars of health that we don't really talk about that much as being important.
Exactly. I completely agree with you. And there may be a difference too when we're talking about sex or an active sex life, it's healthy, active sex life, and sexual health, for that matter, because there's bits down there that I think we need to look at and pay attention to. And for some people, it's a stigma. And in order to be healthy, if you're looking for optimal health, you got to pay attention to the sexual health, whether or not you're having sex.
Exactly. I totally agree with that. The sexual health, the system is interesting because it's a nice sort of indicator of what's going on, system wide. If you stop having morning erections, if you lose your libido as a woman, if you lose interest in sex, or if it's painful, there's something going on. And it's a kind of a good indicator to look a little deeper to see what that is, whether it's a hormonal issue, whether it's a mindset issue, whether it's a social issue, emotional connection issue, like whatever it is, there's something going on that, at the very least get the bottom of it. And then you can decide if you can want to move forward and have sex or not.
Yeah, good. It's excellent. So here's another one. Older women can't orgasm.
Wrong. Definitely wrong. I have so many patients who are, in their 60s, 70s. I have women in their 80s. And they come to me sometimes because they have just stopped, they started having problems with orgasm, and that is concerning to them. And oftentimes we're able to reverse that. So that's absolutely not true.
Yeah, I understand with studies in sex, like research of sex, that many of the participants are women over 40, 50, and they say that many of them are having the best sex of their lives around 50. So this is fantastic news. So you probably can.
Absolutely, because you know yourself so well at that point. Like, you've had all these years with your own body to
Yes.
figure out, what works, what doesn't, and maybe your partner, if they've been with you for a while, has also had some time with you to figure out what works. So I think that makes total sense that things should get better and better.
Yeah, and actually there is a revival maybe, because think about, there are couples out there that, kids have taken over and they start to separate. They get farther and farther apart sexually, and they haven't had sex for months or years. It's almost like relearning it if you want to reprogram yourself or reignite your sex life. And if you haven't had sex in years with your partner, I can imagine it's probably very awkward, no?
Yeah, it's like being a teenager again.
Yeah. Yeah. You're like, what do we do?
Not quite that bad.
You got to go to sex school, go see Kim and Ami or something, right?
Right.
So, okay, there's another one interesting. Older women don't need to worry about STDs, sexually transmitted diseases.
Yeah, definitely false. There's been a lot of STD outbreaks or STIs, I guess they say now,
Mm.
in like nursing homes and assisted living facilities and care facilities and places like that, because the population of some of these are pretty rowdy, and they kind of get around a little bit, and people just don't think about the infection risk, but it can happen at any age.
Yes, is exactly what we learned in gerontology as well. Plenty of older people having lots of sex, and they do need to worry about it just like everyone else. Um, so, how about our expectations? We should expect to have the same sex as we did in our 20s, even when we're over 50.
Yeah, I think that that's definitely not true. Obviously things change. What you like changes. What makes you happy changes. The way, especially if you have a male partner, how his body is working changes. He may have difficulties with erections. Maybe it's not lasting quite as long, or it's not quite the same. So there are a lot of things that can change as far as how that dynamic looks. But I don't think that means it has to stop by any measure. I think it's just about adjusting to what's happening with both partners.
So, what would you do for a man who's not having his erections anymore? What kind of treatments are you finding most successful with?
We have a whole lot of things. The low intensity shockwave therapy, like Gainswave, it's really effective in probably about 80% of men.
What is that?
We
What does
It
that
is.
look like?
It basically it's a machine that we have in the office, and it uses high intensity sound waves delivered like this, like kind of gun shaped handheld device. It sounds like a jackhammer, and these guys will do about 6 treatments over the course of 3 weeks or so, where you're just in the office for 30 minutes and you get this sort of the sound wave treatment. It's a little bit uncomfortable, but we use numbing cream for it. But basically, what it does is it recruits stem cells to the area. It increases VEGF, which is going to increase blood vessel formation and blood flow, and increases local nitric oxide, which is really important for erection. So we see a lot of people having improvements with this. We can also do injections into the penis with PRP stem cells, exosomes, which can help again with kind of regenerating the tissue. We can do hormone replacement. Low testosterone is a big cause of problems, certainly in men over 50 or so. So just replacing that testosterone can help. And then I'm working with a company right now that we're using electricity and essentially applying electricity to the penis in a sort of specific way, where you're sending in specific signals in a specific order to increase specific protein production to help repair the smooth muscle cells, the nerves, the blood flow, things like that. So there are a lot of technologies aside from Viagra, aside from Cialis, that are here or soon to be here that can help men.
Oh, interesting. So, to explain a little bit, some people who don't know it, when you said PRP, platelet-rich plasma, that's when you remove your own blood from your own body, spit it in a centrifuge, and then re-inject it into the site that's necessary. Yes. And if you've been following me for a while, I've done some podcasts on that. I've done my own on my knee and my hip, and I absolutely love it. But injecting it into the penis sounds painful. but
it's
actually
not. It's not that we numb the skin first, and it's a little tiny needle. It's not that bad. We also do the same thing for women, by the way. We do clitoral injections, we do vaginal injections, kind of G-spot area injections.
And what is that? How does that then? What does that do for a woman? PRP in the vagina.
So, you can, again, you're trying to increase blood flow to the area. You're trying to increase sensitivity, potentially repair tissue that's been damaged or it's kind of aged. It can also be helpful for in decreasing the signs of stress urinary incontinence in women. So if you have someone with kind of mild to moderate symptoms, just by increasing the health of the tissue underneath the urethra there, where we're injecting kind of around that G spot, you can support the urethra a little bit, and we'll often have improvement in that. So we see, people will have oftentimes improvement in vaginal dryness, improvement in sensation, orgasm, and lubrication is, like I said, it's a big one as well.
Oh, interesting. Okay.
You can put PRP literally anywhere. It's like this, magic, not magic, but it's this growth factor mix that can help, anything from your joints to your skin, to your hair, to your vagina.
Yeah, exactly. That's another great, the sex and the skin going together, doing your PRP injections in your face for that rejuvenation. So this is really, rejuvenation, rejuvenating your vagina, rejuvenating your skin. And I love it because it's your own stuff, right? It comes from yourself, and there's no chance of rejection. And, especially for people who are not into Botox or don't want it can't compare. I don't think it's the same effect, but right. They're different. They're just different. So I think that would be a wonderful alternative. So, okay. So let's go to the next one. Okay. There's nothing you can do to reverse an aging vagina. And I think you just answered that one.
We just talked about it. And also vaginal lasers like Femilift, Mona Lisa, Diva, things like that, and radiofrequency devices, which these are usually done in the doctor's office, like vaginal radiofrequency, like Viviv. These are also things that can be really helpful for helping with, again, with increasing the health of the vaginal wall, especially in people who are not able to take estrogen for some reason, although most people can, or helping with tone, tightness, sensation. So pairing like a vaginal laser with something like PRP injections or estrogen, and all of those things can go a long way to reversing any problems.
How do you decide then what's better for somebody? If it's better a laser, better PRP, what are the conditions?
I use lasers. Lasers are going to treat the whole vaginal canal, versus the PRP injections are really more kind of vulva and just inside the vagina. So it's going to treat the outside where the clitoris is, and then it's going to treat just inside, a couple of centimeters where that G spot is. So it's not going to go. We're not going to go all the way in with injections, all around. You could, but generally we're not. So if it's like a vaginal dryness issue, oftentimes I'll do a laser treatment or the radiofrequency treatment, or I'll send patients home with something like a VFit device, which is a vaginal red light therapy device that you use at home. And that can also be helpful. It's very gentle. It's a home device. It's just a wellness device. You do it a few times a week, and that can be helpful for increasing blood flow and increasing, vaginal sensation and dryness. Also, it's not as good as like estrogen or vaginal lasers, but I think it's a great home tool that I'll oftentimes send patients home with. So it just kind of depends on what they're looking for. Oftentimes we'll pair these things together. I mean, the best treatments in my mind are you combine several of these treatments together to give them, multiple benefits.
Can I ask then, what is the cost of these types of treatments? How much does somebody need to invest?
It really depends on where you're going, who's treating you. At my clinics, if you have my physician assistants or nurse practitioners treat you, it's going to be less than if you're having me treat you. But I would say for the PRP, you're starting probably around $800 to $1,000 for injections. And that depends on kind of where you live in the US.
Is that per injection, or is that for like three?
It's usually for one session. The lasers, usually you'll get like if you get three laser treatments, for instance, maybe it's going to be $2,000 or $3,000 for that three. But again, it kind of depends on where you are. Some places are a lot less expensive, some are a little bit more. So it's kind of variable. And these things are generally not covered by insurance, unless you're seeing, some of the laser treatments by an OBGYN for a specific, stress incontinence may or may not. But for the most part, because a lot of these are considered to be either investigational or they're considered to be kind of more like cosmetic-y kind of things, they're not covered by insurance.
They shouldn't be cosmetic-y. This is longevity, aging, sex. We should be paying more attention to it. So with these treatments, do people just do it once in their life and they're done with it, or do they have to do it several times?
Oftentimes they'll do it like on a, maybe once a year, once every 2 years. A lot of it depends on what else they're doing. So if you're doing, for instance, if you're on hormone replacement therapy and or vaginal estrogen, and everything is really staying pretty youthful, then you probably wouldn't need to repeat it as much as if you weren't. So, and if you're generally healthy, if you're taking, doing supplements or exercising, all the things that are going to contribute to health are going to slow down the aging process everywhere in the body, including in the sexual tissues. So that will make a big difference. But oftentimes people will repeat these things, occasionally, once every year, once every 2 years, things like that.
Yeah. And I've heard you on other podcasts, and I like how you really stress that, these are great treatments, but you also teach your patients and clients about the foundations of health, right? So that you do have a better outcome. And in terms of your diet, exercise, sleep, stress management, because it's so much more powerful when you have that combination, right? Because go back to smoking and being out in the sun and expect, just a PRP to save the day.
Right. Yeah, it's so true. And in fact, I won't treat active smokers at this point, as far as with the injections, with the PRP or stem cell injections. I don't treat active smokers, just because we know that the healing isn't as good in that population, and the effects are not really going to be that good. And so what I don't want you to do is to come in and waste your money and feel like, that I just took your money from you. Mm-hmm. So if you're an active smoker, I just try to have people quit, if they can, at least, a month or two ahead of time, before we do procedures. And same thing with, unfortunately, if you have poorly controlled diabetes, if you have poorly controlled high blood pressure, if you have, other sort of metabolic diseases that are pretty significant, these regenerative treatments like the PRP or exosomes or stem cells or things like that are just not going to be as effective, because you don't have, you have this, I think of it as sort of like a garden, right? Like we're essentially adding fertilizer to a garden when we do these regenerative treatments. But if you've got kind of soil that's not going to it's not going to grow a lot of crops anyway, then the fertilizer is not really going to help. So we got to work on that soil first and get the sort of the foundational health stuff dialed in first before we start stacking on any of these extra things.
Well, I'm so glad you mentioned that. It's so important. So then the next question, or the next myth, if your partner isn't interested in sex, then there's nothing we can do.
I think that there's a lot that you could do on your own. I think that, that masturbation, self-pleasure is important, whether you have a partner or not. Certainly if your partner is not responsive or not interested, or if you don't have a partner, there's no reason that you can't enjoy what you have and enjoy your body. And I am very much on the pro side of that argument.
So what would you recommend to somebody who doesn't have a partner in terms of masturbation? Or is there like somebody you'd refer to, or do you just say, go and get this toy, or what would you recommend to somebody?
Yeah, I think a lot of it depends on people's comfort level. If you're not comfortable with the idea of that at all, then certainly there are books and tons of videos and things like that out there. But I think a lot of it's just kind of experimenting, like get into a safe place where you feel comfortable, put on some nice music. There are a ton of different great sex toys out there. But you could also just use your hands and see what feels good. I have some patients I've had women come to see me who are in their 40s and their 50s. They've had kids. They've done all these things, but they've never had an orgasm. And they've come to see me because they were hoping I would do a procedure on them. And when I start talking to them, some of them have never even looked at their vulva, or they've never touched themselves. They've never, that's not something that they were taught, that it wasn't okay to do that. And, what I told them is I can't do a procedure on you because it's not going to be that helpful. You have to start with like learning what feels good. I think you'll have much more success just spending some time with yourself, whether that's with a toy, with alone, than you will with me putting needles, in your vagina. It's super powerful, and it's free, and it's easy, and it just takes a little bit of practice.
Yes, absolutely. So we've been so conditioned in the Western world and other parts of the world as well, is, when you think about even a baby changing the diaper, and if it's a female, she starts to touch herself down there, people would just pull the hand away and put on the diaper and say, now, so starting from baby times, right, you could be conditioned. that you just don't go there. Or, really it's sad, because then we get older and go, okay, well, we've never even touched ourselves down there, and we don't even know what we like, we don't like. So I encourage people, like you, to explore. But you just got me thinking, you said there were videos out there we can follow to learn more about this stuff without, are we not talking about porn? I'm just saying, would you be able to Google on YouTube and say, well, how to masturbate, and would something pop up? Like,
oh my gosh. Well, yeah, there'd be a lot of things that would pop up. Probably things that you may not want to see. I don't have any off the top of my head, but I've definitely seen sites like there's an app called Rosie that might have some good information. It's an app specifically for females. It's to help with increasing libido, and it does a lot of sexual education. And I know that they do video series and things as well on that. It's like ROSY, I believe. So things like that are geared to women, but in a way that's smart and tasteful and not going to make people cringe, I think are probably the best avenues to go into.
Oh, that's so good to know. It's so good to know. I was thinking, where do you go without going down the porn route? And you just want to be educated, and if you have a safe space as well to learn, to explore. I mean, why not? This is sexual education for midlife. Like, really.
Yeah. Yeah. Isn't it funny how we don't get sexual education beyond like 10th grade when we learn about, wear a condom and don't get an STI. Like, that's basically the end of it. After 10th grade, it's like, you're on your own.
And even that, what we got was pathetic, So it's really, really sad that we don't talk more about this, and I really hope that we're disrupting this a little bit, so that our future generations will be much more comfortable about it. And it is a part of you. It is related to aging and longevity and happiness and so many other great things, whether you decide to have sex or not. That's, like you said, your own interest. But really, to have sexual health is really important, I believe. So, okay, I just have to open up the questions to everybody else. I'm getting to you. I just want to, there's so many other myths I want to buzz, but I know you have to get to work. But before we open up, I promised I would ask you a question about rapid rebound. You posted this on your Instagram, and it was super interesting. And, I don't think it's related to sex or to sex and skin, but in a way it is. So tell us a little bit more about what that is.
So that is a new supplement that me and a couple of people on my team came up with just in the last year. We kind of put this formulation together. It's basically it's a peptide blend, 2 peptides and an amino acid, a fatty acid amide. But the peptides that are involved are BPC-157, which I think most people who are probably following know what that is. But it's an amazing peptide for healing. And actually, it does have a number of skin benefits as well, for skin healing, for collagen production, and things like that. But it's most known for musculoskeletal healing, for improving for tendons and bones and joints and cartilage and things like that. And then it has in there as well AOD 9604, which is a growth hormone fragment that's also specifically aimed at healing. So it's kind of like some of the benefits of growth hormone without the insulin effects or some of the other downsides. And then the last one that's in there is called PEA, and that's an anti-inflammatory and pain, it helps with pain as well through the endocannabinoid pathway. So it kind of works in the same kind of pathway as something like CBD, but it's a little bit different. So this is a peptide blend that's an oral blend, which is unique in that, previously you had to get prescriptions, you had to do injections on yourself, and that was kind of painful. And so this product is an oral product that's actually well absorbed. And so we're pretty excited to launch it. Thank you for asking.
Well, yeah, no. So where could we get it?
So if you go to letter11labs, all spelled out.com, then you can get it there. And I have a discount code, which is just Killen25. So if you use that, you can get 25% off.
Oh, great. KILLEN. So,
yes.
Oh, that's so great. Do you deliver outside of the US?
Not currently, but just from regulatory issues, we don't, for reasons of regulation, but hopefully eventually we'll have to go through all the hoops and see where we're allowed to go from here. But so right now, just in the US.
Oh, darn it. Yeah. When I saw BPC 157, I was like, oh, there's one. Okay, I can get this now because it's so hard for us to get in Europe.
Yeah.
And if you don't want, especially when we want to go down the ejection route, I thought it would be perfect. So I'll have to slip it into my kids' suitcase when they come and visit me
Right.
from the US.
We'll load you up.
Yeah. Oh, excellent. So one last question before we open up. What are you doing on a daily basis to keep your sex life active and your skin youthful?
Oh my goodness. The biggest thing I'm doing that I'm getting better and better at is sleeping, which people don't talk about, but it's so closely tied with both skin health and sexual health is getting, a good 7 or 8 hours of sleep. I have a Uller mat, which is like a chili pad, but it keeps your bed cold at night, which I love. So that's been really helpful. I have a great eye mask. I have a whole routine now. I have this little infrared mat that are, kind of PEM mat that I'm using before bed. So I have this whole like sleep program. And I think it's waking, when I wake up, I just feel so much more ready to kind of tackle the day. So that's really big. I'm 45, so I am not on any kind of hormones yet, but I am following that and tracking that and make sure I, check all my blood counts. And when I, eventually will kind of, I do a lot of hormone replacement in my office, and we'll definitely keep an eye on those really closely because I want to make sure that that I know exactly what's happening. But really the big thing is sleeping, exercising is, a big one as well. And then I do have the VFit Plus, which is that red light therapy device that I told you, that intravaginal one. Love that. So I'll do these what I call face naps, where I have a red light therapy device that I wrap around my face, and I turn on my white noise, close my door, and then I put my VFit in, which is a vaginal device and also red light therapy. And then I just lay there for like 30 minutes. And and it's so fit. I just love it. My kids know that if I'm doing my face nap, like not to come in my room because it's like my meditation time. So that is it's amazing. So I highly suggest adopting it.
Oh, that is so funny. I think I got to go find out this. I heard about the VFit before, so I'm very curious about it. Anytime you talk about red light therapy too, it's just, there's got to be some amazing rejuvenating benefits for that.
Yeah.
So I'm going to open up the panel. If anybody has questions here, please, you can unmute your mic. You can ask any questions. Lucia, there you are. We can't hear you.
Hi, I'm packing. I have the last 10 minutes. Sorry. Hi. Hello. Thank you.
Hi.
Yes. Hi. Just maybe I have 2 questions. One, do you recommend any vaginal gym?
Any vaginal what?
Sort of gym, train, just to move, to do some exercises.
Like a pelvic floor exercise, maybe?
Pelvic floor, yeah, exactly. So Kegels, of course, are excellent for your pelvic floor, and that's just the contracting those vaginal muscles, like you're stopping your urine flow. And there's a bunch of different ways to do Kegels that can be really effective. And I recommend throughout the day doing these short bursts of Kegels for sure. Any kind of things like Pilates and yoga where you're engaging your pelvic floor is going to be really helpful for keeping the pelvic floor muscles intact. And then there are also some great devices. There's a device called, and I don't know if it's available widely, it's called Intensity device or Apex device. I know it's here in the US, but it's essentially an intravaginal TENS unit. You know what the TENS units are that you put on your muscles and it contracts your muscles. So there's one, a medical device that you actually just put inside your vagina at home, and it contracts those pelvic floor muscles. And it's amazing. It's really good for strengthening those muscles. So that can be really helpful as well.
Where do you buy it? Online?
Online. The company the device is called Intensity or Apex. Apex is the medical device. Intensity is the non-medical, but it's the exact same device, except for it has a vibrator on it as well. So that's I don't know what the company, I think it's by, I would know I'll have to look it up. I can't remember the company's name, but just look up Intensity device or, Intensity intravaginal TENS unit.
Mm-hmm. And another question, libido. So I feel that I'm losing it because I think I'm get bored of the same partner after 20 years. Yeah. Do you think it's psychological?
I mean, it's definitely true that, if people who are with the same partner for a long time, it's a lot easier to kind of get bored. It's certainly a thing that happens. I think that, you have a couple of choices. One is to just really start to try to mix things up with your partner as far as, trying new things, doing things that you just haven't done before, or opening, or, obviously you could open up to other partners. There's kind of a lot out there. There's Esther Perel writes a lot. I don't know if you know Esther Perel, but she's a fantastic author.
Yeah, I know her very well.
Yeah, okay. And she writes a lot about sort of this thing that happens where you start to feel very safe and secure, but then you lose the excitement and energy with long-term relationships, and how to balance that. So I don't have all the answers. I wish I did. I've been with my husband for 23 years at this point, so I understand.
That's long. You don't. So you
feel. I mean, this is common, right? It's not only me.
It's very common. It's very common. It's a big reason why people cheat and why people have affairs. Is that after 7, 10, 15 years, you still love your partner, but they're just not as exciting as they were before, right? Like I think that's totally normal. And there's a lot of different ways to handle it, and I'm not sure that any of them are perfect, but I think that it's absolutely normal.
No, because I think maybe I should take some estrogen, some hormones to make me feel more attracted.
Right. Yeah, it's hard because that's the thing about sex. It's so tricky, right? It's hormones are a piece of it, but if it's also are you excited? Do you feel good about yourself? Do you love your partner? But also, do you want to have sex with your partner?
Could I take something like some pills to be more attracted by the same husband?
You could certainly try to take some things that will make you just more, like for instance, there's a peptide called PT141. I don't know if you have access to it there. It's a drug in the US called Valisi that's got FDA approved here. And it's a melanocortin pathway drug, basically, but it makes you it makes you horny. It makes you have an increased libido, and it lasts for hours, like 6 hours. And so something like that, might be helpful.
What's it called again? Let me write this down.
So the peptide itself is called PT141. But it's an FDA approved drug here in the US that's called Valisi, which is VYLEE.
I don't feel very comfortable. I think it's chemical, right? It's nothing natural.
Well, it's basically the same. So there's a hormone or a chemical called melanocortin in your that's stimulated in your brain already, and there are already these hormones. This particular drug is the same hormone that's just kind of truncated. So it's not natural, but it's very similar to something that's already in your head, in your brain.
I will use my creativity.
Yeah.
Otherwise, PT141, the horny drug.
The horny drug. It can certainly help, but it also can have side effects. It can also make you have headaches or nausea. It's definitely not perfect, for sure.
It's not for me. No.
Yeah.
Thank you anyway. Thank you very much.
You're welcome.
You might want to consider, I have to say, Kim Anami is brilliant, and she has got a lot of great posts on Instagram, but she also has a sexual courses courses on relationships, and I think you've got to go listen to the podcast that I did with her. She is really, really interesting, and so she talks a lot about, so she goes down the natural route, but you may want to consider one of her programs. Or I have to say, I did the 30-day sex challenge. That definitely worked for us. I've been married, I don't know, over 25 years, and it was fun. And I think that's one of the things that you can do. But I do also think that your brain is one of the biggest sex organs in the body.
Totally.
So we have a lot of power there. So, but good to hit it out on all different sides as well. So like you do your treatments, taking different approaches, and something will definitely work. Magdalena, do you have any questions before we wrap up? She could be in the car. All right. I think, yeah, either she's trying to unmute or not, but okay. I know she's been popping in and out, and she probably has a question. There you go.
Do you hear me?
Yes.
Hello.
Hello, Amy.
Hi.
I'm so finally see you online. I'm so sorry because I'm traveling and I am in the middle between Croatia and Slovenia, and I'm nonstop out of the signal. So I have missed so many important parts of your interview. I am personally very interested in this new supplement. What does it mean if you take it in regards of, let me say, sex? Yes, sex desire or whatever. Thank you.
So which supplement are you talking about? The peptide, like the PT141 peptide?
Yes, what you have posted recently, also on Instagram.
The rapid rebound. So that one is not specifically for sex. That one is more, it's going to be more for skin and just healing and musculoskeletal pain healing and kind of just keeping things like injury free.
I see. Okay.
That one's not so much for sex. I would love to put together one for sex at some point, but right now a lot of the peptides for sex and libido are not allowed without prescription. So I'm trying to figure out a way to do that at some point.
Thank you. But what would you say when you are comparing estrogen and testosterone?
So they're very different. Estrogen is the primary hormone that women need at any time. So certainly postmenopausal estrogen is the one that you're going to miss the most. But it's good. So it's important for everything from skin health to bone health, heart health, basically all systems wide in your body you're going to use estrogen. Testosterone is also important for women. It tends to be necessary for things like motivation, like kind of get up and go. It can help with reducing like abdominal fat and adiposity around the midsection. It can help with building muscle and certainly with libido as well. But so generally you're going to want to do a combination: estrogen and progesterone and testosterone.
Nope, she could be out of the signal. We
Yeah.
can't.
Thank you. I'm using so far estradiol and progesterone. Hello, do you hear me?
Yes, we hear you. You're using estrogen and progesterone.
Yeah, and now I'm waiting to get testosterone as well. So I will report if I noticed any difference. Thank you.
Good.
Otherwise, I don't have these problems you are addressing today, but maybe it will be even more interesting when starting using testosterone.
Yeah, keep us posted. The only thing with testosterone is you're going to watch out for breaking out. You can sometimes get skin breakouts with testosterone when you first start taking it. So just keep your dose kind of low at first.
Good advice. Really good advice. So, okay, we're going to wrap up now, unless Magdalena has one more question, but you're going in and out. So if anyone wants to reach out to you, I have your Instagram, which is at Dr. Amy B as in boy, Killen, Killen. And you're also on YouTube, Dr. Amy Killen, and Facebook, Dr. Amy B Killen, just like your Instagram. And you got a website, dramykillen.com. Is there anywhere else that people should reach out to you?
Those are the main things. I have multiple websites. I have my stem cell clinic website, which is Docere Clinics, DOCERE clinics.com. And then my actual clinic, other clinic here in Utah is biorestoration.com. So I have a lot of websites, but one of those, reach out to one of those and you can find me.
And if somebody wanted a consultation with you, even though they couldn't actually get to you, you're in Park City, Utah?
Yeah, Park City and Salt Lake City. So I'm not taking new patients right now, except for stem cell patients. My clinic, Biorestoration, is taking new patients, but you do have to be able to come in for the initial visit. So we're not doing telemedicine except for after that first visit.
Okay, that's really good to know. So if anyone is around, or at least in the US,
yeah,
wanting to do stem cells, then they could reach out to you. Is there anything last minute you'd want to share about sex and skin before I let you go?
No, I think that we've covered everything. I think the main thing is to, stay optimistic, stay curious. There's a lot out there that we can do at this point, a lot you can do to improve sexual health and skin health, and don't give up on yourself at any age.
At any age. I love it. Well, thank you so much for your time. I will see you on Instagram, and keep doing the amazing work that you're doing and paving the way for us women in midlife to keep having happy sex and beautiful skin. So have a great day. Thank you so much.
Thank you, Zora. Bye-bye.